Bladder control is an important function that we learn as children. Unfortunately, Alzheimer's disease sometimes erases that knowledge, and patients may develop incontinence or they may actually urinate in the wrong location. This program describes ways to manage that problem while still respecting the dignity of the individual.
Many older persons develop trouble controlling their bowel and bladder functions. The inability to control bowel or bladder elimination is called incontinence and is distressing to the resident even when the person is affected by dementia. Usually incontinence occurs over weeks or months, not suddenly. Sudden onset of fecal or urinary incontinence could suggest a new health problem and should be investigated by a physician. In order to understand the best treatment for incontinence, it's important to understand how the bowel and bladder work. Bowel function is similar in both men and women. However, bladder function is significantly different between the sexes. In bladder function, urine is produced by the kidneys and flows into the bladder, a sac-like structure, where it is collected. It is eliminated from the bladder to the outside via a tube called the urethra. This tube helps maintain control and also protects against bladder infection. Older women may have two problems with their bladder. The bladder sags, and the short urethra allows leakage or contamination by germs from the skin. Always wipe women away from the urethra, from front to back, to avoid contamination and infection. The male bladder has problems because the urethra must pass through a donut-shaped tissue called the prostate gland. This gland swells in older men, kinks the urethra, and makes emptying the bladder difficult. Males may be unable to empty their bladder completely, or in extreme cases, hardly at all. The prostate gland itself can become infected.
Welcome to today's relay race here at the urinary track. As our guys gear up for the race, let me introduce you to them. Our first leg of the race is the kidney. His job is to produce urine. Wave to your fans, kidney. Our second leg of the race is the bladder. The bladder will collect urine from the kidney. Wave to the camera. And last but not least, our third leg of the race, the urethra. The urethra is responsible for transporting the urine outside the body. Wave to the camera. It's time for the race to begin. Our runners are taking position. Here comes the count. And he's off. The kidney seems to be doing well. However, most men and women's problems occur in the bladder and the urethra, so we're not in the clear yet. Here comes the handoff, and it's good. Now, this part of the course is a bit more difficult. He must overcome the sag that older women may develop. Can he make it? Yes! And the handoff, it's good! The urethra leg of the race is by far the hardest. Older women may experience leakage or contamination by germs from the skin. The urethra in older men has to come through the prostate gland, which may become swollen. Wow, he cleared them both. He really is on today. Now, let's see if he can finish the job and get the urine out of the body. He's going. He's out of here. Congratulations to today's runners. They did a terrific job. As you can see from all the hurdles, though, it's not always easy.
In addition to the physical aspects of toileting, dementia patients face other obstacles. Alzheimer's patients may fail to understand their brain signals that tell them their bladder or bowel is full. Residents who have difficulty comprehending language may not understand the question.
Do you have to use the bathroom?
Most disoriented Alzheimer's residents can no longer find the toilet facility, and some can no longer visually recognize a toilet as a toilet. Many residents also forget how to undress. Others are unable to position themselves properly on the toilet. After undressing and sitting on the commode, some may stand without completing the toileting process because they rapidly forget why they are sitting. Males may have difficulty urinating from the standing position. The simple task of toileting for all demented residents becomes almost impossible without assistance. Remember to be kind, because this can be very upsetting to a resident. Toileting schedules can help. Residents with urinary incontinence should be taken to the toilet every 2 hours and assisted with undressing. They should be prompted to sit on the commode and encouraged to sit there for a reasonable length of time to allow their bladder to relax and the flow of urine to begin. Soiled residents should be changed as rapidly as possible. Be kind and understanding. Some residents may struggle during the changing process because they do not understand your attempt to help them, or they misinterpret the disrobing as an aggressive act. Clara is clueless.
I do not believe it. You have just soiled yourself. I asked you if you had to go to the bathroom. You do this all the time just to make me mad. Well, it has worked. I'm going to start putting you in diapers. How would you like that? You just think about that while you sit there in your filth.
What did Clara do wrong? She asked Mr. Nichols if he had to go to the bathroom instead of keeping him on a regular toileting schedule. She got angry with Mr. Nichols when he soiled himself. She quickly resorted to adult diapers. She didn't change him right away. Steve is smart.
It's time to go to the bathroom.
Yeah, we can undress.
Okay, let's get you seated. All right, we're gonna wait here a little while, okay?
What did Steve do right? He kept Mr. Nichols on a toileting schedule. He assisted Mr. Nichols with undressing. He prompted Mr. Nichols to sit on the commode. He encouraged Mr. Nichols to sit for a reasonable length of time. He was kind. Remember that improper toileting is not bad behavior. Dementia patients never soil the facility for attention or in retaliation. Toileting accidents result from confusion, disorientation, and failure of toileting schedule. Adult diapers are always the last resort. Family members should be consulted prior to the use. Even with such incontinence products, residents should still be toileted on a regular basis. Residents should be changed frequently, as wet diapers can cause skin breakdown. Bowel movements vary from resident to resident. Some have one a day, while others may eliminate waste less frequently. Poor bowel function can cause loss of appetite, agitation, hostility, and fecal incontinence. Hydration is the best way to assure that bowel movements do not become hardened and difficult to pass. A doctor may administer medication to soften stools if necessary. Residents often need to toilet when they eat something because the food stimulates contraction of the colon, and so they leave the dining hall and go to the bathroom during meals. This can be avoided by toileting prior to mealtime. Residents with hemorrhoids may complain about discomfort and may need medication to ease discomfort. Residents can't be expected to remember if they had a bowel movement or not. Staff must confirm the passage of a bowel movement. If a resident doesn't have a bowel movement for several days, it should be reported to the nursing staff.
Order.
I'll have order. You're in court now.
Inside the courtroom right now, Judge Minot is about to hear the case that's being called the Great American Bathroom Blunder. The plaintiff, Mr. Smith, has filed a complaint with the court about the poor treatment he's receiving from his caregiver. Oh, they're about to begin. Let's go inside.
Okay. Mr. Smith, you filed a complaint about the poor care you're receiving at your facility. Please explain to the court exactly what your problem is.
I'm an Alzheimer's patient, and I live in a facility, and Dence Dolores is my caregiver. You know, and sometimes she expects me to get up and go to the bathroom all by myself. Well, I have trouble getting around, and sometimes I don't even know where the bathroom is, and occasionally I have an accident, and Dence Dolores gets so upset. She punishes me by letting me sit there for up to 30 minutes or so, and then she made me wear adult diapers, and my family would be so upset.
Well, what do you have to say for yourself, Dence Dolores?
Well, I ask him all the time if he has to go to the bathroom, and he just looks at me like he doesn't know what I'm talking about. And then I check on him 5 minutes later, and he's gone on himself.
You ask him if he needs to go. You ask him if he needs to go. Did it ever occur to you that maybe he doesn't understand what you're asking him? He's an Alzheimer's patient.
Whatever.
You do have a toileting schedule, do you not?
Well, no.
And did you know that by not changing soiled diapers, you are damaging Mr. Smith's skin? And you probably wouldn't even need the adult diapers if you would keep him on a toileting schedule.
Yes, but...
No buts. You need to learn patients' rights. Incontinence is the inability to control bowel or bladder elimination. Obviously, your patient is suffering from this. Some residents have difficulty comprehending language and may not understand your question, do you need to go to the bathroom? Most disoriented Alzheimer's residents can no longer find the restroom or recognize the toilet. Toileting schedules are important. Residents with urinary incontinence should be taken to the toilet every 2 hours and assisted with undressing. Soiled residents should be changed as rapidly as possible. Adult diapers are a last resort, and family members should be consulted prior to use. And most importantly, be kind. Remember that improper toileting is not bad behavior. Dementia residents never soil the facility for attention. Mr. Smith, I am ruling in your favor. Your caregiver, Dence Dolores, obviously needs more training. She doesn't seem to know anything about Alzheimer's patient care. Dence Dolores, I hereby sentence you to watch the entire DetaCare video series.
Well, as you heard, the judge has just ruled in Mr. Smith's favor. Let's see what he thinks. Oh, Mr. Smith.
Yes?
How do you feel about the judge's decision?
Well, I just can't wait to receive proper care. You know, my family's going to be so happy.
As are we. Thank you, Mr. Smith. Another happy ending. Thanks for watching.
Hi, and welcome to I'm on a Game Show with Celebrities and Squares, where the celebrities answer questions whether they're right or wrong. I'm your host, Burt Bacharach. Let's meet our contestants. This is Karen from Jasper, and this is Chuck from Arizona. Let's get this game show started. Okay, Karen, here's the first question. Miss Walsh is an 82-year-old woman with Alzheimer's disease. She sometimes experiences urinary incontinence, but then hides her underwear. She always denies having wet herself. What should you do?
Urinary incontinence. I bet Drew knows this one.
Why not leave a note on her door that says, "Don't forget to pee," so she won't wet herself?
Now you listen to me, because Whoopi always knows. Now you show her that underwear to remind her that she has a problem.
Earth to Miss Walsh. Come in, Miss Walsh. You should call her daughter and ask the family to encourage her to pay more attention.
I'm surrounded by amateurs. Take Mrs. Walsh to the toilet every 2 hours and immediately before bed. Don't let her drink excessive amounts of water after dinner time.
Alrighty then. Sometimes I really wonder. On to the second question. Chuck, this one's for you. How can Mrs. Walsh's occasional urinary incontinence be explained?
I think I'm gonna go with Whoopi on this one, Bert.
Honey, it seems to me that she has a bad attitude.
Are you serious? She has an aging bladder and can't remember the location of the bathroom.
She can remember. She's just resistive to assistance and suggestions.
Listen to me, I know what I'm talking about. She's unhappy about residing in the assisted living facility.
Karen. Mr. Hall is a 78-year-old gentleman with Alzheimer's disease. He usually self-toilets, although sometimes he requires reminders. You notice that he is consistently asking about the location of the toilet, and he seems to be urinating very frequently. This new behavior is very distressing to the resident. What is a possible explanation?
I think I'll go with Whoopi for this one, Bert.
Huh. Seems like he has a prostate infection to me.
Sounds like he has a bladder infection, actually.
I would say he has problems emptying his bladder completely.
Seems like all of the above are possibilities. And he should be referred to the nurse for further evaluation.
Okay, moving right along. Chuck, this one's for you. Mr. Gorman has mild dementia, and he often asks for assistance when using the bathroom. In this last week, you've noticed that he has not had a bowel movement, and now he seems irritable and resistive. He is only eating parts of his meal. What is a possible explanation for his irritable behavior?
I think I'm gonna go with Whoopi on this one, Bert.
Child, Mr. Gorman is obviously unhappy with that cook's menu. I had the fish and it was nasty.
The cook's menu, huh? He's unhappy with the quality of the food.
This is a result of fecal matter collecting in his rectum and causing him to feel badly.
Good old Mr. Gorman is sick of the assisted living facility and wants to go live with his son.
Karen, this is your last question of the round. Mr. Winslow is a 90-year-old gentleman with Alzheimer's disease. He has severe vision problems secondary to his cataracts. He sometimes urinates in the corner or in trash cans. How do you explain his behavior?
Let's go with Whoopi on this one.
Oh, not Mr. Winslow. That fish-eyed fool ain't nothing but stubborn and mean. He just thinks he can urinate wherever he pleases.
It seems he lacks the motivation to use the toilet like you've repeatedly told him to do.
Mr. Winslow is disoriented. He cannot find the toilet and he needs to empty his bladder every 1.5 to 2 hours.
You know, Mr. Winslow spent many years in the Army, and he's used to urinating wherever he wants.
Chuck, are you ready for the final question of the game? Good to hear. Mr. Stevens is a 79-year-old gentleman with advanced Alzheimer's disease. He has been incontinent for over 2 years and now is beginning to show evidence of bowel incontinence. What should you do?
I think I'm going to go with Whoopi on this one, Bert.
Let me tell you what Whoopi would do. This is what Whoopi would do. Toilet him every 2 hours. 2. You got that? 2 hours.
Use those adult diapers, you know, the Attends, to keep him from soiling himself or the environment.
Check those Attends frequently to see that he does not remain wet.
Well, all those are important measures, as well as careful skin care to avoid infections.
All right, that was a good game today. Our contestants did well. Come back and see us tomorrow on I'm on a Game Show with Celebrities and Squares, where the celebrities answer questions whether they're right or wrong. Bye-bye.